really, really inspiring what you said, especially about the open source and other, and what we need to build in terms of skills to ensure integrated second workforce to our workforce, right, in Africa. So thank you for those. There are a few questions on chat we will get later because of time and respect for the other panelists and speakers. So Dr. Brahanu Alamayo, if I can give you the floor, please, to moderate panel 1. Thank you.
Thank you. Thank you very much for the opportunity. Thank you for inviting me. I'd like to thank Dr. Naugao and the other organizers, especially Dr. Naugao for that warm introduction about me. So thank you. I assume all the panelists are there. Mr. Rodit, Miss Manhat, Miss Helen, are they all in the Zoom, right?
Yeah, yes, Dr. Brown.
Okay, perfect. Thank you. So I assume everybody's there. The topic that AI is impacting the healthcare sector at scale, as you know, the previous opening remark maker, especially Vamicius outlined, it's very, very extremely vast. So what I did was for this panel, I identified a set of topics that could be relevant. We may not cover all of them, but based on these topics, I identified a set of questions. I'm going to ask the panelists to respond to those questions in not more than 2 minutes because I have a set of questions. So for the sake of time, that's how we're going to conduct the panel. So the major topics, as outlined earlier also, is that AI, for example, for strengthening primary healthcare systems, scaling disease surveillance and early outbreak detection, AI-enabled diagnostic innovation, improving workforce productivity and addressing skills of healthcare shortages, medical supply chain optimization, supporting preventive medicine and public health campaign like localized, inclusive AI for underdeveloped or under-resourced populations. For another issue is governance, policy, and the pilot to scale failure problem. Infrastructure gap, as stated, data systems, connectivity, and compute power, ethical issues, safety and data practice concerns. Funding is a big issue, sustainability and shift towards small AI. All these are extremely relevant, important issues. So what I did is I just picked a few questions from this set of, important topics. I'm going to pose these questions to the panelists. But before I go to the actual panel, I like each panelist to introduce themselves in just less than half a minute. So let's start with Redit, if you can introduce yourself just briefly.
Thank you, Doctor. My name is Redit. I'm the CEO of RFP Financial Technologies. RFP is a fintech company operating here in Ethiopia.
Could you please mute, please, guys? Could you please mute?
Yeah. So that's more about me. Yeah. CEO of RFP, currently specializing in fintech industries related to payments. So these days we are moving into AI, and we have developed Arif Care, which is an AMR plus HIS system for the healthcare industry here. And we are integrating AI into this platform so that our country, our doctors, the medical sectors can benefit from it.
Thank you, Ms. Thomas.
Thank you. My name is Manhat Thomas. I am the co-founder and CEO of Kronos EDX, which is an educational technology platform that leverages AI to personalize learning to increase comprehension. Based in Rwanda, Ethiopia, and the United States.
Thank you very much. Third one, Miss Helen. Miss Helen.
I think she's on mute.
Okay.
She's on mute.
There we
Helen,
go.
are you there?
I was getting a message that I wasn't being allowed to unmute. So, hi everyone. My name is Helen Adioson. I am the former CEO and founder of Care Academy. We recently transacted Care Academy into private equity. So, working as a chief strategy officer at Activated Insights. I come at this work and really am really excited to be on the panel. And so appreciate, the esteemed panelists as well as the platform today. I come at this having been a direct care worker. We've had the privilege of scaling Care Academy among 1 million direct care workers, mostly here in the US context, but among primarily direct care workers who are from the broader African diaspora as well as the Caribbean, primarily and have delivered over 6 million training hours to about 1 million direct care workers, and have the privilege of now serving also as a Henry Crown Fellow with the Aspen Institute. It's a pleasure to be here today.
Thank you. Thank you very much for that introduction. So I'll just go directly, for the sake of time, directly to the questions. I'll pose the first questions to Ms. Thomas. Ms. Thomas, let me start with the workforce and empowerment and capital building topic. So how can African tertiary institutions ensure that healthcare graduates are not just AI users, but AI literate professionals capable of critical judgment, ethical decision making? Just 2 minutes. Ms. Thomas.
Sure. Thank you. Yes. So I am the believer, just like you, that technology is actually an enabler and not a tool to be used separately, without the intervention of humans. So I think this question actually asks more questions of us, and I think this is where the there's deeper work needed. AI literacy must be embedded across curriculum. It cannot be an isolated single elective module that is taught to students. It has to be embedded within the curriculum, within the training, so that it will be used in clinical reasoning, not in isolation. I think we also must teach interpretation and not just interaction with the AI tool. Prior to that, though, I think anybody that's being trained on AI or with the AI tools must understand where the models are getting their data, where we might have biases existing, where what uncertainty looks like, and in some cases to even override the automated outputs. And then lastly, I think the assessment models also must be continuously evolving. I think the way we teach is pre-AI knowledge economy, and I think that has to change. If we're giving exams to continue rewarding memorization and not facilitating true comprehension, we're not going to be cultivating the workforce. We're not going to be cultivating evaluative reasoning. So I think where AI comes in best is, with case-based simulations, and I think Vamshi said that very well in one of her slides. AI augmented decision scenarios should become the standard. I think at the very core of it, ethics must be integrated early and continuously. The goal is not to produce clinicians that know how to use AI. It's to produce clinicians and healthcare professionals that know how to reason with it and challenge it and help develop it and strengthen its system, right? I think Vamshi also said that, it's a tool that needs to be strengthened and developed. So we should teach it along those lines. We should teach it what we need. It should have context and nuance and culturally sensitive materials that are geographical based. I hope that answers your question.
Thank you very much. Thanks. Yes, you did. Thank you very much. So, unrelated topic, just Reddit, you can also chime in on what Ms. Thomas said, but I will ask one more question here. How is AI reshaping the role of health workers in Africa, from community health promoters to physicians, and what new competencies will be required? 2 minutes. Ready?
Thank you, Doctor. Yeah. It's amazing how the world is adopting AI. Just like phones, we cannot live or move without our phones, right? AI is becoming or following that trend, right? Not just only in the health sector, but everywhere. But coming back to the health sector, it's really redefining the way we interact with our patients and the way we handle data. For example, if you take a look at the community health workers, right? So earlier they used to take notes, right? And at a later stage they put the note into the system, blah blah, right? But with AI these days, the phone workers are moving with the phone, right? They can ask guided questions, translate those answers, and turn those voices into text. So it's going to be very easy for them, to do their day-to-day activities, and that, not just only that, right? So it can also suggest what's going to be the next step after doing the interviews or collecting the information. The AI can also give them alternatives on how to handle that data. For example, refer this patient to or admit this patient. So any kinds of further informations that the health workers need, it can be easily provided to them, right? The same goes for the clinical staff and the doctors. Vamshi said one thing, right? So most of the community, the AI community or users, we tend to use AI as a tool, but she put it perfectly. AI is a talent, right? And talent needs to be used wisely, right? Otherwise, the whatever that we are getting out of it can mislead us. So, like the previous speakers, what they said, right? So treating data is very critical. We shouldn't be exposing AI to patients' informations. That's very, very crucial. But apart from that, we don't need to rely that much on AI as a tool, but treat it as a talent, like someone that's assisting us in our day-to-day activities, right? So from this perspective, I believe AI is making a huge impact currently in the industry. So from the new skills perspective, so uh, we shouldn't teach AI to everyone. I mean, AI is not for everyone, right? But even if that's the case, the way we teach it and the content that we provide should be limited or segregated. For example, you can teach AI basics, right? So that they can easily understand what AI is, how it helps them, what are the good sides of AI, what are the bad sides of AI. So from this perspectives in the health sector, AI basics needs to be taught um, not just only on the hospitals or in the medical fields, but in schools as well, right? So we have Dr. Bakadu here, right? So whenever our doctors are getting their educations in the universities, right, they need to be taught of AI from that perspective, right? They need to align it with their day-to-day works, so that not just only on practicality while they are being taught, they need to know how to use AI, right? How to provide quality data so that the inputs are right and the outputs are right? So it's sometimes AI tends to be garbage in, garbage out, right? So whatever we need to provide it needs to be very, very, very accurate. Not just only that, right? So AI, remember, it's a talent, right? So we should take it as an input, right? We need to learn how to override it. We need to learn how to challenge it, right? So from that perspective, we can safely use AI. So just to summarize, right? So the new skills that we need, right? So AI basics is a must, right? So nowadays, no one teaches us how to use a phone, right? It's become an inherent instinct. So the same thing needs to be with AI, but people need to be taught on how to use AI. They need to be taught on how to provide good data to the AI, so that what we get is the right thing. Yeah.
Thank
Thank you,
you.
Doctor.
Thank you for that. That's great. So the next topic, I think I'm gonna switch to that's for Miss Addison on funding and models and sustainability, because that's becoming a big issue. So this is the question for you, Miss Addison. So with global development assistance declining, what new funding models or partnerships could ensure the long-term sustainability of AI healthcare solution in Africa? Miss Addison.
Yes, thank you so much. I really appreciate the opportunity to respond. I just actually maybe want to go back to the previous